My name is Ailish and I'm a chartered physiotherapist with TheBumpRoom. You're watching a video blog that we're doing on have you got pregnancy related pelvic girdle pain. So from personal experience, I am currently 20 weeks pregnant on my third baby, and I experienced pelvic pain in my first pregnancy and my second pregnancy. So I have a lot of empathy for people that get this. So you might hear it described as different terms. Sometimes it's described as symphysis pubis dysfunction or a type of sciatica. But really what will indicate if you have it or not is what activities aggravate it, and also how the pain is, where you describe the pain. So generally the pain can be anywhere in this region, okay? Classically it can start in the groin, okay? Women will describe it like along the knicker line, and it can extend deep into the groin and almost like it's up inside you, okay? You can also get it in the buttock, okay? Some people will describe like a shoot, sharping pain, like you're being stabbed with a knife in your bum, okay? That sensation of very sharp pain. And that pain can extend down your leg and also up into your back. So they're the classic signs, the classic way you would get pelvic girdle pain. And then the activities that will bring on your pelvic girdle pain or make it worse are turning in bed, okay? Going from sitting to standing, so getting up from a chair, getting up from the couch, pushing activities like pushing a buggy or pushing a trolley or hoovering, okay? Then activities where you are slightly bent forward, okay? So like putting a toddler into a car seat, or putting a child down into a cot, or even just getting some groceries out of the boot of your car. Also standing on one leg, so just whenever you're getting dressed, maybe putting on your underwear, putting on your trousers, standing on one leg can aggravate it. Going upstairs, getting out of a car as well is another activity that tends to aggravate this pain. And sitting in very low chairs, so if you're sitting in a low deep couch and it started to get painful when you're sitting in the couch. So they're the classic activities that would indicate that you have pregnancy related pelvic girdle pain. Now what I would say about pelvic girdle pain is that there are degrees of severity. It can be mild, moderate or severe, okay? So, and the other thing about it as well is it tends to come in peaks and troughs, okay? So if you get pelvic pain, what I would find with women in the classes is they might have a few rough days, but then it will settle and it will come back down, okay? So just to bear that in mind, if you're having a really tough time with it, that generally during the pregnancy, that pain won't be sustained. It will come in peaks and troughs, okay? But it's all about how you manage it. So what I want to do next though is show you just a quick test as well, just to confirm if you do have pelvic girdle pain. So this test involves lying down flat on the mat, okay? So I'm just going to come down onto the mat like I would if I had pelvic pain as well. So just coming down, hands and knees, and then going onto my side first, okay? See when I go on my side, how I'm going to just lean through my elbow, fall onto my side, and then I'm going to push through my elbows and push through my feet as I roll around onto my back. Now I'm going to lengthen out one leg and then lengthen out the second leg. So this test is called the active straight leg raise, okay? So all I'm going to do is I'm just going to float one leg up towards the ceiling and then back down, and then I'm going to float the other leg up towards the ceiling and back down, okay? So as you can see, I can do that fairly okay. I find the left leg a little bit harder, which is the side that I get my pelvic pain on. So I'm fairly mild at the moment, okay? Now for some women that would have moderate or severe pelvic pain, they just won't be able to lift the leg, or they would have severe difficulty doing it. They'd be pushing through their hands, doing everything they could to lift it, okay? So if that's you, I would recommend that you go to see your local women's health physiotherapist, and they can give you a lot of help and advice. Now, just to demonstrate the rolling, very important when you're getting out of bed. One leg up, second leg up. I'm going to push through my elbows and push through my feet and roll onto my side. See the way my elbow's underneath here, hand by my side, push up through my elbow, push up through my hand. So I'm doing a little bit more work with my hands and my feet in order to get up and roll, so I can save my pelvis a little bit. Okay, so that's pregnancy related pelvic girdle pain. Thank you for watching. If you'd like to subscribe to see more of our videos, you can just go to the website, TheBumpRoom.ie, and please keep watching and sharing.